Good morning, everyone, and mabuhay. Greetings from the Philippines to wherever you are right now in the world. Welcome to today's webinar entitled The Whys and Hows of Psychiatric Nurses and APRNs. My name is Leah, and I will be your moderator for today. In behalf of St. Anthony's College and the Filipino Nursing Diaspora Network, in collaboration with the ADPCN, or the Association of Deans of the Philippine Colleges Region 6, the PNA Region 6, or the Philippine Nurses Association of Nursing Service Administrator of the Philippines Iloilo chapter, we would like to welcome our participants from different institutions. Today, we are grateful and blessed that you have led us your precious time to join us in this webinar. We welcome our almost 1,000 participants for this webinar.
Akon mga kasimanwa, atin awitin ng buong puso
ang pambansang awit ng Pilipinas.
Kayang magiliw, helas na silanganan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, kuya ka ng magiting, sa manlulupin, di ka pasisigil, sa nagatang tutok sa simoy at sa langit mo pagaw, ay tinatang tula at awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nagtitindig, ang bituin at araw niya kailan ang may magtitindig. Luman ang araw ng warhabit pagsinta, buhay langit sa piling mo. Ang hindi kaya na pagkay mga api, ang mamatay ng dahil sa'yo.
Do not let your hearts be troubled. Do not stay afraid. It is really I whom you see. I offer you now my peace. I have waited for this moment to be with you again. heart you'll remain, in your heart I'll stay. I am with you till the end of your days. I am in you. Have faith that I hold you, even when you let go. And I love you, you must know. I am here, I am ever with you.
Do not let your hearts be troubled. Do not stay afraid. I'm beyond all anguish, all death. I'm risen to life anew. When you feel that you've been emptied and can give no more, know that I am your breath, and I fill your soul. I am with you till the end of your days. I am in you. Have faith that I hold you, even when you let go. And I love you, you must know. I am here, I am ever with you. I am with you till the end of your days. I am in you. Have faith that I hold you, even when you let go. And I love you, you must know. I am here, I am never with you.
Just a few reminder, we ask you to please mute your microphone to ensure that the background noises don't disrupt the program. This webinar is also being recorded and we are on Facebook Live. We also encourage attendees to use the chat or Q&A function that are asked for you to ask questions. We also encourage you, to ask questions. However, please remember that your post may be viewed by all attendees. Please be also mindful of what you share, avoid personal or confidential details, and never share inappropriate materials. We also encourage all of you to help us spread what's happening and share today's webinar on your social media networks. At the end of this webinar, we also be sending a link for the webinar evaluation form. We would greatly appreciate if you could please complete the form, because the feedback you will give us will be very beneficial to ensure that the future webinars will be relevant and would provide a collaborative, engaging, and interactive experience for other participants. So for today's webinar, we have a total of 7,000 participants who registered, but unfortunately, we can only accommodate 1,000 participants here in Zoom. Our apologies for we cannot accommodate everyone here, but we're again live in Facebook. And for those joining us in Facebook, will also be receiving their certificates. Again, thank you. And for those of you joining us, welcome to today's webinar. And now let us listen to the messages. First, to give her message is Professor Violeta A. Lopez, PhD, RN, FACN, the President of the Filipino Nursing Diaspora Network. Ma'am.
I know.
Can you hear me properly?
Yes, ma'am.
Okay. Good morning to all attendees of this webinar entitled The Whys and Hows of Psychiatric Nurses and APRNs by our invited speaker, Dr. Argie Rivera, a nurse practitioner from Arizona, USA. In recent years, there have been increasing acknowledgement of the important role mental health plays in achieving global development goals. According to the WHO in 2020, many mental health conditions can be effectively treated at relatively low cost, yet the gap between people needing care and those with access to care remains substantial, and effective treatment coverage remains extremely low. The shift from institutional to community-based mental health services has been uneven and has stalled in some countries, and people with mental health problems continue to face human rights issues of great concern. Increased investment is required on all fronts, for mental health awareness, to increasing understanding and reduce stigma, for efforts to increase access to quality mental health care and effective treatments, and for research to identify new treatments and improve existing treatments for all mental disorders. In 2019, the WHO launched the Special Initiative for Mental Health, Universal Health Coverage for Mental Health, to ensure access to quality and affordable care for mental health conditions in 100 million people. More than 20 years ago, Barker et al. Asked what psychiatric nurses need for. They concluded that psychiatric nurses are in a position where they can contribute lines of communications and actions to deliver appropriate psychiatric and mental health care. Psychiatric nurses have been called upon to work in mental health nursing field to care for and support patients with mental illnesses. More than 20 years ago, Barker also asked and concluded that psychiatric nurses are in a position where they can contribute lines of communication to deliver appropriate psychiatric and mental health care. They position psychiatric nursing as a profession with specific responsibilities and opportunities. The psychiatric nurse provides care and support the physical and mental health of individuals, groups, families, communities which are affected by mental health conditions. Sometimes they are referred to as psychiatric mental health nurses or psych nurses who have received specialized training that helps prepare them to take on additional responsibilities needed to care for patients with psychological and behavioral problems. Psychiatric mental health nursing requires a wide range of nursing, psychological, neurobiological, psychosocial expertise. They promote well-being to prevention and education in addition to assessment, diagnosis, care, treatment, and many more that they can do. Advanced practice registered nurses are well educated and practice according to high quality licensing and credentialing standards of the country. I am sure that our guest speaker for this seminar will provide us more information about the role of psychiatric nurses and answer why do we need psychiatric nurses nowadays. As the president of the FiND network, I would like to extend the Board of Directors message as well, our sincerest appreciation and thanks to St. Anthony's College, PNA Region 6, PNA Antique Chapter, and ADPCN Region 6 for organizing this webinar. To all participants, take home the important messages from our invited speaker today, because she is a nurse practitioner mental health. And thank you and have a good day.
Thank you so much, Professor Lopez. This time, let us hear another message from the Governor of the PNA Region 6. Let us all welcome Dr. Rosana Grace Bello de la Riarte. Ma'am.
Ladies and gentlemen, greetings all the way from the PNA National Headquarters here in Manila. Happy New Year, everyone. Welcome to the year opener activity of the PNA Regional Council in cooperation with the Filipino Nursing Diaspora Network, ADPCN 6, and hosted by the PNA Antique Chapter and St. Anthony College, Antique. Psychiatric nursing is such a challenging career that focuses on mental health and well-being. It is unlike any other kind of nursing. For example, we cannot fix depression, like we care for a patient with fever, or fix a broken leg, or maintain fluid and electrolyte balance through our IV fluids. As such, not so many would really go into it in their professional nursing practice. It is in this light where this webinar becomes relevant. This activity can offer additional understanding so that we may be able to open our minds and hearts that while psychiatric nursing is very challenging, it can be one of the most rewarding decisions one can ever make. So to all our participants, sit back and relax, enjoy the rest of the day. My appreciation to our speaker, Dr. Argie Rivera, who will be introduced more appropriately later, for giving us her time and offering us her expertise in this field. Psychiatric nursing was second to my most loved subjects, second to community health nursing when I was a student. And, you know, I would really love to stay here for the rest of the day. However, I have to attend to the meeting which is going on now. So happy listening, happy learning, everyone, and enjoy the day. Thank you very much, Dean Ariskandel Bugabong, our PNA Antique Chapter President, for this continuing professional education activity. Keep up the good work. Thank you and good morning.
Thank you, Dr. Grace. Another message from the President of ANSAP Iloilo, Ms. Helen A. Caton, MN, RN. But in her behalf, let us listen to Ms. Romeline Matutina, MAN, RN, the ANSAP Iloilo Secretary. Ma'am.
Good morning, everyone. We are not the light, but can be the bearers of it. On behalf of the Association of Nursing Service Administrators of the Philippines Iloilo Chapter, my warmest greetings and felicitations to St. Anthony's College of Nursing and the officers and members of the Filipino Nursing Diaspora, the FiND network, for the timely holding of this interactive webinar on psychiatric nursing and advanced practice nursing in psychiatry. Indeed, this collaboration is laudable. As part of a role in the healthcare industry, that is to organize an event to widen our knowledge. And this is an opportune moment to know the whys and hows of psychiatric nursing. The webinar brushes upon a spectrum of exciting and benefiting things that will discuss the aspects of being excellent psychiatric nurses. This will serve as a venue and reaching out through sharing experiences of the current practices to members and other members of the healthcare team. We're responsible in shaping decisively the future of psychiatric nursing. What nourishes your heart will in a mysterious way color and put meaning on what you do. For when the being is right, so is doing. Allow me to express that nursing generally not defines the physical caring aspect, but is totally of human thoughts and understanding. We are indeed learning why this individual has developed beliefs and personality all throughout his lifetime. And through this online platform, we invited guests across the globe to share advanced evidence-based practices in the field of psychiatric nursing. Well, mental health is as vital as physical health. To emphasize some values that nurses must have, it is the value of being kind and compassionate to anyone else. To deepen our psychiatric knowledge, not focusing on the superficial actions and gestures, but understanding the rationales why it triggered this mood and behaviors. Well, the association is one with the best psychiatric nurses who are BTS. B, being aware of oneself. The ability to be aware and to accept her own strength and limitations should help her recognize the strength and limitations in other people. T, the non-judgmental attitude. You need to be able to accept people who they are. And S, strong therapeutic rapport. Therapeutic rapport leaves each patient feeling safe and respected. As Mother Teresa said, not all of us can do great things, but we can do small things with great love. Again, the Association of Nursing Service Administrators of the Philippines in the chapter is one with you, BTS. So again, congratulations to the facilitators and God bless everyone. Good morning.
Thank you so much, ma'am, and thank you so much for your warm and inspiring messages this morning. To introduce our resource speaker, we welcome the Dean of the Nursing Department of St. Anthony's College and the President of the Association of Deans of Philippine Colleges of Nursing, Region 6, Dean Aris Kendall R. Bongabo. Sir.
A pleasant morning to everyone, and thank you to our guest collaborators. It is my great honor to introduce good friend and a fellow advocate. Dr. Argie Rivera is a psychiatric nurse practitioner in a community mental health center in rural Arizona, USA, and the owner of Cara Behavioral Health. Dr. Rivera is also an adjunct faculty of Grand Canyon University, teaching the NP 810A, Emerging Areas in Health. She was one of the founding officers of the Philippine Mental Health Nurses Association of the Philippines, and she is the founder and the CEO of the Kalinga Psychiatric Nurses Initiative, a US registered NGO of psychiatric nurses and advocates with members from the different parts of the world and in the Philippines. Ladies and gentlemen, let us welcome Dr. Argie Jamaica Rivera. Dr. Argie.
Hi, good morning, everyone. So let me try to share my screen. So just so you know, I'm very overwhelmed. So and thank you for that warm introduction, Dean Aris. So can everyone see my my slide?
Yes, Ms. Argie,
okay.
here's nice.
So let me see. So you will, so how I do things is I usually check on my, so I work remotely. So the reason behind me telling everyone about it is because you will see me always glancing on my side, just checking on my phone. I just making sure that I'm being respectful to everyone's time. And then let me see. Okay. So again, my name is Dr. Argie Rivera. Today's webinar is entitled The Whys and Hows of Psychiatric Nurses and APRNs. There are, I think, 2 or 3 questions that hopefully everyone or some of you can join, just so we can get some of your insights, or knowledge about today's topic. If you have any questions, feel free to type it in the chat box and we'll try our best to answer it. So to start off, this is the list of today's content. We're going to be starting in terms of the objectives of today's webinar, the common definition of terms. So just to avoid confusion, the mnemonics that I usually use, or sometimes I interchange those. So just to avoid that confusion, we're going to be discussing the population that we serve in the world of psychiatry, the most common setting that a psychiatric mental health nurse can be employed. Then we're going to be moving forward to actually the first part of today's talk, which is psychiatric mental health nurses, the standard of practice, the degree and licensure needed to be a psychiatric mental health nurse. And then we're going to move forward with part 2, which is APRNs. We're going to be focusing more of the history of APRNs, history of psychiatric mental health APRNs, scope and practice based on the consensus model, the roles of the 4 APRNs, differences, similarities between CNS is clinical nurse specialist and NPs are nurse practitioners. So I'm going to give you some definition of terms just to avoid confusion. And then lastly, just a quick recap of today's webinar. So let's start. So I can only accommodate like 200 participants. So if anybody want to join, you can join by typing in you can type in ahaslides.com P7Q76. Again, there's only like 2 or 3 for today's webinar. I'm trying my best to kind of like just get your knowledge about things. And second, because I enjoy this. I'm an audiovisual learner, so I like seeing like very colorful slides and add more like interactive ways of how I can give out my webinars. Okay, so last 1 minute. And also I will try my best to make sure that I capture today's webinar for a good 2 hours or less, so we can still accommodate like question and answer at the end, okay? The last 5 seconds. So there's only 2. So the first question is, what is not included in the 4 roles that represents advanced practice registered nurses here in the US? So is it certified nurse practitioners, clinical nurse specialist, certified nurse anesthetist, certified nurse midwife, and certified nurse case management specialist? So what is not included? So there's actually 4 roles, but what is not included? Again, the first question is what is not included in the 4 roles that represents advanced practice registered nurses here in the US? Is it a certified nurse practitioner, clinical nurse specialist, certified nurse anesthetist, certified nurse midwife, or certified nurse case management specialist? Okay. So the right answer is actually certified nurse case management specialist. So again, we have 4 roles that represent advanced practice registered nurses, nurse practitioners, clinical nurse specialist, CRNA or certified registered nurse anesthetist, and then certified nurse midwife. Okay. Good job, Alan. Okay. So for today's objectives, I have 2 parts. The first part is for psychiatric mental health nurse topic. The objectives is to be able for you guys to identify 3 standards of practice of a psychiatric mental health nurse, for you guys to identify 3 common clinical settings and their respective population being served, and to enumerate the educational requirements and to identify the licensure needed to be a psychiatric mental health nurse. So for the second part, APRNs, the objectives include to define the advanced practice registered nurses and be able to enumerate the 4 roles of APRNs. Second is to enumerate the educational requirements to identify the licensure needed to be either a clinical psychiatric nurse specialist and or psychiatric nurse practitioner. Third is to identify the scope of practice based on the consensus model. And lastly, to differentiate the scope and standards between a clinical nurse specialist and a certified nurse practitioner. So some definition of terms that I want to start off just to avoid confusion and just to give clarity. So the first one is, what is psychiatric mental health nurse? So psychiatric mental health nurse promotes integrated and comprehensive health and wellness through prevention and education, as well as assessment, diagnosis, care, and treatment of the full range of psychiatric mental health disorders, including substance use disorders across the lifespan. Psychiatric mental health nursing practice transpersonal caring to promote the health and healing of humanity. The practice of PMH nursing is a science and an art based on evidence and the purposeful use of self in the therapeutic relationship. So how about what is advanced practice registered nurses? Or you will hear me say APRNs. So what's an advanced practice registered nurses? APRNs are registered nurses who have successfully completed a graduate program of study in advanced direct care nursing practice. These individuals obtain specialized knowledge and skills that form the foundation for expanded roles in healthcare. On the other side, you will see some mnemonics that I will be utilizing. APRNs for advanced practice registered nurse, NPs for nurse practitioner, CNS for clinical nurse specialist, CRNA for certified registered nurse anesthetist, PCP is primary care providers or general physicians. So for definition of term, the certified registered nurse anesthetist or the CRNA, they are APRNs that provide anesthesia care before, during, and after surgery. So we're not going to talk about that today, but I just want you guys to know what they do. The certified nurse midwife, on the other hand, are advanced practice registered nurses who provide and care during preconception, pregnancy, childbirth, and postpartum. And then certified nurse practitioners are APRNs who provide full range of primary, acute, specialty healthcare services. So standards of practice is defined as it describes a component level of nursing practice demonstrated by the critical thinking model known as a nursing process. And lastly, the scope and standards defines the boundaries, parameters of nursing practice, and the expectation of competencies demonstrated. So scope and standard is actually something that we need to understand to be able to know our limitation and our boundaries, especially if we're talking about advanced practices. So second question for everyone is, actually, it's not a question, it's just a poll. So what clinical setting in psychiatry are you not familiar with? So if you want to join again, you can join by going to ahaslides.com/P, number 7, Q, number 7 and 6. So what clinical setting in psychiatry are you not familiar with? And we'll give everyone about 2 minutes to answer, or less than 2 minutes to answer. Okay, so most of you guys are not familiar with forensic. Okay, and then second is custodial or group home. And then we have some like community mental health clinic and substance rehabilitation centers. Okay, very good. So first and foremost, I want to discuss the population. So what are the population that we serve in the world of psychiatry? So the first is the general population, or the general public, you know, those clients who are diagnosed with generalized anxiety disorder, major depressive disorder, or those that have some medical issues like comorbidity wise. So they are the general public or general population. The second population is the substance use population. This population includes those that are diagnosed with alcohol use disorder, cannabis use disorder or marijuana, stimulants use disorder or yung shabu kung tawagin natin, opioid use disorder, including like morphine, anything narcotics, even caffeine addiction. So those are the substance use population. It can be by itself, or it can be as dual diagnosis. Dual diagnosis meaning it's not only substance use that they struggle with, but also mental illness or even medical. The third population is the most common one, honestly, is the serious mental illness population, or as what we call SMI. These are the population that are that their usual diagnoses include schizoaffective, schizophrenia, bipolar disorder, those that really need not only medication management but wraparound services. They are deemed SMI, meaning they need more care, they need more services, and most of them unfortunately cannot have their own, cannot work by or cannot take care of themselves, you know, things like that. SMI. The next one is child, adolescent, adult, and even elderly population. And then lastly is forensic. So most of you guys are unaware of forensic. Forensic is, it includes yung juvenile detention kung tawagin, those that those minors that need to be in jail or in prison. Also, I think forensic includes those that are in trials, prison, jail time, anything about forensic. Okay. So clinical setting. So I added this picture because I want you guys to understand that if you hear the word inpatient psychiatric hospital, it looks like that, to be honest. Here it doesn't look different. It's gone are the days, it's been like decades ago that that you're going to be afraid of even getting inside the a psychiatric hospital. So it actually looks like this. So what are the clinical setting where a registered nurse can work as a psychiatric mental health nurse? So first and the most common one is the inpatient hospital or acute care. So one example is the National Center for Mental Health. So what they do is they need to stabilize client. So for stability, acute care. Second most common one is the community-based clinics. So community-based clinics, it can include those privately owned by psychiatrists or psychologists, and also like health centers kung tawagin natin. Community-based clinics are actually, the goal or the essence of it is integrating clients or the population that we serve in the community integration, meaning they're getting a lot of services in the community, in that health center, not only medication management, therapy, but also vocational services like looking for jobs, even finding work, going back to school, and other groups that they can attend and other support. So that's the community-based clinic. The third one is care coordination and case management. So there are these nurses work hand in hand in terms of coordinating care from one office to another, or let's say in the hospital and transitioning to community-based clinics. So that's the care coordinators and case managers, RNs. Then we have the substance drug rehabilitation centers. So these are where the substance population usually needs to go, either to detox from the substance that they're withdrawing, or they can transition to a 30-day or 60 or a 90-day longer treatment for recovery or long-term, I call it long-term treatment, long-term stability. So that is the substance drug rehabilitation center, because we're not going to stop, we don't stop by them just sending them home. It should be not only collaborative care, but moving forward. And then lastly is what we call the forensic mental health. Again, these includes the juvenile detention, correctional unit, jail, prison. They are also called psychiatric mental health nurses. So part one, psychiatric mental health nurses. What I want to emphasize here is the standards of practice. Oftentimes, people will ask me, or nurses will ask me, so what's the standards of practice? What's the Bible? What's the competency of a psychiatric mental health nurse? So that's why I added this one in my slide. There are 3 slides for standards of practice. It's actually 10 pages long or more than that if for the competencies. So I'm just gonna give you some tidbits of the competencies per standard. So this first slide, if you notice, if you're a student nurse, you will notice that it's the nursing process. So the standard one is the assessment. So assessment, the standard is the psychiatric mental health nurse collects and synthesizes comprehensive health data that are pertinent to the patient's health. So that pertains to the history taking. It includes the head-to-toe assessment, history taking, asking not only history of mental issues, but also socioeconomics, environmental factors, upbringing, family history, and so forth. We also want to make sure that we understand and we ask our clients' values, principle in life, their strength, even as simple as their hobbies in mental health, because the focus is always patient-centered care. So that's the first standard assessment. Standard 2 is diagnosis. So It's the psychiatric mental health nurse analyzes the assessment data to understand or to determine the nursing diagnoses, problems, and areas of focus for care and treatment. The competencies includes understanding or knowing the actual and potential risk, knowing the right nursing diagnoses for appropriate care. The third standard is outcome identification. So you're identifying, or the nurse identifies expected outcomes based on the patient goals. Patient goals also includes his or her own beliefs, a health literacy even, and also strengths and values. Standard 4 pertains to planning. So the psychiatric mental health nurse develops a patient-centered plan that describes strategies and alternatives to attain expectation. The focus for planning, and always remember this, is it's going to be patient-centered. It's going to be the client. It's not you, the nurse. It's not the psychiatrist, not the psychologist, not the family around the client. It's the client. So it's a patient-centered approach. It's always strength-based, while making sure it's you're practicing culturally sensitive care. Okay. Standard 5 is implementation. So you're implementing the patient client-centered care. One thing that I want to add for standard 5 in terms of competencies is we want to make sure that we advocate for them. We want to make sure that we're that person. Okay. So in terms of the implementation, to be able to discuss it thoroughly, it's subdivided into several sections. So that is the second and the third slide for the standard of practice. The standards 5A includes coordination of care. So coordinates the delivery of care. So we coordinate not only with the provider, but also with nutritionists. If you're a practicing psychiatric nurse, you know that most of the psychotropic medication or second generation antipsychotics has metabolic risk, right? So we want to make sure that they understand that they need to watch out their diet too, that they need to make sure that they know when to check your blood test, things like that. So we coordinate not only with the provider, but with the healthcare team as well as the family. Standard 5B, health teaching and health promotion. So this is actually our forte. Psychiatric mental health nurse employs strategies to promote health and safe environment, while always taking into consideration, and I always emphasize this, that you always need to make sure that it's client-centered, whatever your client feels he or she is comfortable with. And health literacy. Standard 5C is consultation. So the psychiatric mental health nurse provides consultation to maximize outcomes from the identified plan, collaborates with other clinicians to provide services and contribute to system change. Standard 5D is the biological therapy. So the nurses incorporates knowledge of pharmacological and biological interventions with applied clinical skill to restore the patient care. And that's the reason, again, if you're a student nurse or if you're a faculty, we always want to emphasize these to the students, that it's not because it's not only the pharmacists who need to be aware of the medication, it's also us nurses, because that is under our competencies, that is under our standard of care, to be able to understand that and know. It doesn't mean, I always tell my mentees, my students, that it doesn't mean that you need to memorize the entire drug guide, but it's understanding how to find resources and to utilize it with the best of your abilities. So in terms of medication or psychopharmacology or psychotropic medication, the essence of knowing what resource to use is you can always teach client to even check on that. So knowing the resources, understanding how you use your drug guide, and being more assertive as a nurse, being able to educate client and be advocates for your client. Just check my time. Standard 5E, complementary or integrative therapies. The psychiatric mental health nurse incorporates knowledge of complementary integrative interventions sorry about my typo, which includes yoga, meditation, acupuncture, healing touch, and etc., with applied clinical skill to restore the patient health. So remember, one of the competencies of psychiatric mental health nurse is being able to know complementary integrative therapies. So it sounds like it's basic, you know, in the Philippines, but remember, if you go to a rural area in the Philippines, they have medicine man, diba? We have medicine man in the Philippines. We need to be able to understand the client's concept about medicine man, or even have some insight about what they do for us to be able to provide care. So let's say, you know, we need to make sure that we know how ginseng can help with mood, or how low vitamin D can be worrisome for your mood and for your energy level. We need to be mindful. We need to be understanding how yoga, how acupuncture, chiropractic, or massage can be beneficial, because we provide care as a whole. So that's a standard 5E and its competencies. Standard 5F, or milieu therapy, is psychiatric nurses provides a safe, therapeutic, recovery-oriented environment in collaboration with patient. Standard 5G includes the therapeutic relationship. So we use the therapeutic relationship as the basis for interaction and the provision of care. The standards 5H is counseling and psychotherapy. So it's a hot topic, even as far as I know, even as of this date. But as a psychiatric mental health nurse, we are able to provide, that is under our competencies, that is under our standard, that we're able to provide counseling intervention to assist patient in their individual recovery. It's a different question. If you ask me, so Argie, do you feel I'm a nurse, I'm a psychiatric nurse for about 10 years, do you feel I'm able to provide CBT for a client? So that's a different genre, that's a different question. What I am pertaining to counseling intervention is talk therapy, utilizing therapeutic communication, being that person. So those principle, okay? Standard 6, or the last one, is the evaluation. So the psychiatric mental health nurse, as one of the competencies, is able to evaluate progress toward attainment of expected outcomes. So again, remember, I was telling you guys that it's like 10 pages long for the competencies, each standards. The essence, sorry about that. So what I want to emphasize is this. The standards of practice and competencies of psychiatric mental health nurse focuses not only with what I discussed, but also practicing evidence-based practice, conducting or implementing benchmarks or best practices, and also doing research or research finding, and again, client-centered. So those are the 3 ones that I want to emphasize. So I've been doing this the topic for about 2 years now, and it's always the question for me is, Argie, so if do I need to have a master's degree or doctorate degree to be a psychiatric mental health nurse? Do I need to have an experience to be a psychiatric mental health nurse? How can I call myself a psychiatric mental health nurse? So what I want to say is that the only degree requirement that you need to complete is to have your degree, the 4-year program, the Bachelor of Nursing program. Second, of course, you need to have your own license, and experience is actually an entry level. So one example is if you work in a med-surg unit, right, or in an OBGYN unit, you don't need any experience, right? But you need your diploma, you need your license, and what they do is they know that you're entry level, they give you a lot of trainings. So it's similar, it's an entry level one. It's a different question if you're going to ask me, so Argie, is psychiatric mental health nurse comparable to an ICU or OR nurse or cardiac nurse? So it's a different answer, because if you work in those fields, so I've been a med-surg nurse in the past and OBGYN nurse in the past. So if you want to be an ICU nurse, as far as I know, but don't quote me with this, there are hospitals that will require you to be a med-surg first, right? For about a year or two. Or if you want to be an OR nurse, you need to be a surgical nurse or surgery nurse for about a year or two. Or so they have their own levels and progression, okay? Okay, so that's the part one. And then the part two is actually advanced practice registered nurses. So another very hot topic. This is not for me to answer or have resolution for all the questions that we have. I have a lot of there's a lot of question about this one whenever I do whenever I do this kind of webinar. What I can say is the main reason that I always emphasize or add advanced practice registered nurses or even evidence-based practices in any of my webinar is that it's about time. So let's put it that way. But it entails more than that. So that's the reason that, you know, it can be redundant. You can maybe hear this one today and then 2 weeks ago somebody will talk about it, but it's okay, right? This is where we all start. So the first question that I want you to kind of think about is why APRN is important. I can only answer this one here in the US. So why are we important? So first is APRNs participates in health policy activities at the local, state, and national and international level. So just imagine decades ago when they were first having that idea of having an advanced practice. If there's no nurse who stepped up or made some policies or lobbied some policies, we're not going to be here, right? Second is it lowers the health cost. So let's say Mr. John Doe was discharged from the hospital and he needed to see his primary care provider, PCP, or the general physician, but they're fully booked, of course. Advanced practice registered nurses can lower the health costs because there's less readmission rates, fewer emergency room visit. You know how expensive that is, shorter stay, and it's actually lower healthcare reimbursement. And lastly, is I want to kind of like emphasize the PCP shortage is for the reason that US is a big country, right? And just imagine the shortage that we're having for almost decades, not only primary care, but also behavioral health. Research shows that APRNs provided more than 355,000 solutions to the primary care shortage, and then 1 billion nurse practitioner visits each year. So personally, that's the reason I work in a rural area, because there's a lot of programs, or there's a lot of programs when you work in an underserved or underprivileged areas. It's I think comparable with rural areas or yung mga purok natin in the provinces. So, and that's the main focus, you know, of the APRNs. So the second question is actually for you guys. This is not for you to answer directly to me, but to answer directly to yourself, you know. So APRNs in the Philippines ? So we can only just do so much, right? I can only just give you what I have, I can only just give you what I feel is necessary or what needs to be done, but it's always will start in your own heart, right? So as I educate you about APRNs, I want you to think about the question, APRNs in the Philippines ? Okay. So history of APRNs. So why the heck is it important? So the reason that I wanted to emphasize the history of APRNs in the United States is because for us to be able to understand where we started and why we are here today in that aspect. So clinical nurse specialists, they started in 1951. The first CNS program was under Dr. Hildegard Pepla with a grant from the National Institute of Mental Health. And the vision is to link the nursing science and nursing practice. So just imagine 1955. Probably there's only 5 psychotropic medication back then, or maybe less than that, maybe purely therapy, or who knows. But the government or the National Institute of Mental Health is already having that idea or having that insight on how to advance nursing practice. And it's not just for the practice, but also for the nation. Diba? So just imagine that one. So that's for the clinical nurse specialist. Nurse practitioner, on the other hand, started in 1965. It was actually between Loretta Ford, which is an RN, and Dr. Henry Silver, which is actually a pediatrician, who developed the first nurse practitioner program to address the shortage of physician and to increase patient access in pediatric care. So just imagine, working between having two profession working together to advance nursing practice and to be able to focus on providing the quality of care is really worthwhile. So what I want to say is, even as of this day, 2023, there's, to be honest, there's still a lot of physicians, specialists who doesn't like advanced practice registered nurses here in the United States. It's gonna be like that. It's life. It's not gonna change. But if you don't move forward, we don't move forward, diba? So that's what I want to emphasize. If there's even 1 or 2 doctor or physician that believes in our capability and believes in the focus and the goal of advanced practice, everything will be worthwhile. So 1965, so just imagine, okay? Specifically for the history of the psychiatric mental health advanced practice registered nurses. So it actually started in 1960. The focus was clinical nurse specialist. The focus is actually for children, adolescent, and adult. And their goal back then is helping the institutionalized mentally ill person to adapt to community life, meaning community integration. So we're still doing it now. That is still our focus nowadays, diba? But it started from that. Then it moved forward in 1990s, which added, and it was made more of research focus, meaning aside from community integration, they focus on the neurobiological basis of mental and substance use disorder and psychopharmacology. Thus, courses in neurobiology, advanced health assessment, pharmacology, pathophysiology, diagnosis, and management were added in the curriculum. So nag-advance sila. And then early 2000s, they even advanced it more to collaborative care. So emphasis is in terms of comprehensive health assessment and referral management, so as one. So they started with making sure probably the SMI population, of course, they have their own rights. They have they needed to be integrated in the community. They started with that. And then they added the research focus, meaning they added the things that the APRNs need to understand and to learn by heart to be able to advance. And they also added on top of it early 2000 to be able to collaborate with everyone. What I can say, I've been a psychiatric nurse practitioner going to my 6th year now. What I can say is, yes, there are still hiccups, meaning not everybody will be accepting of what we do. But as long as I know what I'm doing, and as long as I know my passion and what I signed up for, that is all that matters. Because at the end of the day, there's still a lot of people who will acknowledge what you do because of the population that you serve. So that is very essential. Oh, I have another question. So if anyone want to join, go ahead. The question is, what is not included in the 4 components of the APRNs as specified under the consensus model? So again, I don't expect everybody to know the answer. I just want it to a little bit just to gather your thoughts. So what is not included now in the 4 components of APRNs as specified under the consensus model? Is it the licensure, the certification, accreditation, examination, or collaboration? So the answer is collaboration. So good job. So the consensus model has 4 components, which is the LACE. So licensure, accreditation, certification, and examination. And I will be discussing it further in a few minutes. Okay, good job. Okay, so advanced practice registered nurses scope of practice is actually based on the consensus model of APRNs, which includes licensure, accreditation, certification, and education. So these 4 areas are actually the ones who defines the specialty areas, the roles and titles to be used, the population focus, and preparation for emerging APRN roles. This model identifies specifically the 4 APRN roles for which to be certified: the certified nurse specialist, certified nurse practitioners, certified registered nurse anesthetist, and certified nurse midwife. So remember the consensus model also addresses 4 areas, diba? The first area is the population and the specialty. So under the certified nurse specialist and certified nurse practitioner, it has its own branches. So the certified nurse practitioner, you can be a nurse practitioner, a psychiatric nurse practitioner, a women's nurse practitioner, a primary care, family nurse practitioner. We have the adult gerontology nurse practitioner. We even have pediatric nurse practitioner, a neonatal nurse practitioner. I think that's about it. So that's for the nurse practitioner. So direct patient care. So that's a nurse practitioner. So for the certified nurse specialist, they also have their own subspecialty, which includes, psychiatry, as far as I know, family, and so I'm not that familiar, but they have their own list in that aspect. So differences of CNS versus NP. So why did I add this one? So again, because of the mental health law and because of the changes that we're witnessing, to be able to adapt to the changes, and to be able to understand how we can move forward to have our own advanced practice in the Philippines, we also need to understand saan ba talaga tayo? I mean, what is the goal of APRNs in the Philippines? What is the focus? What's the objectives? Because clinical nurse specialist is different from nurse practitioners in some ways, and we want to understand where it is. Remember, history-wise, CNS started to institutionalize mental health illness, diba? But so that's for the CNS. For the NP, it started as for pediatric population. So saan ba tayo in the Philippines? So what's where are we? What's the goal? So that's the reason that I added this one, not to compare which is better or not. We don't do that, to be honest. The goal is to work as a team. So the differences is as follows, or the similarities is as follows. So the degree requirement, it should be, of course, either a master's degree or a doctorate degree. I know, but don't quote me with this. They wanted everyone to be doctorate level for the nurse practitioners. Master MSN is the Master in Science of Nursing, and then DNP is the Doctorate of Nursing Practice, which I obtained. DNP is more focused on quality improvement measures, conducting or adopting evidence-based practices to different organizations, benchmarks. So that's the focus of DNP. And then clinical nurse specialist can also be PhD, which mostly focused with a research. So that's the degree requirement. So for the certification here in the US, we for a clinical nurse specialist, we have the ANCC, American Nurses Credentialing Center, and for nurse practitioners, we either have the ANCC and the American Academy of Nurse Practitioners. So the test taking is being conducted by this organization to be able to be certified as a specialist. So you will notice that there are some similarities with the duties and responsibilities. The difference is with nurse practitioners. So I underlined those that are for nurse practitioners. Again, don't quote me with this because my focus or genre is NP. So I'm a little bit not as familiar with clinical nurse specialists, but based from what I researched, and this is as of 2022, the clinical nurse specialists, their duties and responsibilities are geared towards direct, providing, and assisting with patient care, counseling and educating clients and family, leading nursing department and teams, collaborating with other nursing team, conducting evidence-based researches, consult on system and patient outcomes improvement, and teach and advise nurse in training. On the other hand, nurse practitioners, we do assess and treat acute and chronic illness. So depending with your specialty and with your licensure and certification, we were able to order laboratory tests and diagnostic tests where we can prescribe medication. We are able to make referral for specialized care. So want to emphasize in terms of making referral for specialized care, it's usually the family nurse practitioner. As a psychiatric nurse practitioner, I'm not able to refer. So usually the PCP, as what we call them, or family nurse practitioners are the general practitioners, so they can refer. We're able to do counsel and educate, lead nursing department and teams, and supervise. So again, question I have for you guys is, where are we in this aspect? Is our goal to start to be specialist, or our goal is to start prescribing? This is not something for me to address, but it's a question for you, and it entails a lot of like understanding. Okay, let me just check my time frame. So ano ba yung process? What's the process in terms of how can a registered nurse or a psychiatric mental health nurse be an advanced practice nurse, specifically as a psychiatric nurse practitioner, because that's what I do. So the first step is you need to be able to complete an accredited graduate level education program. You need to acquire advanced clinical knowledge and skills to provide direct and indirect patient care and sufficient clinical experience. So that's a step one. Step two is you need to pass a national certification that examines and measures your role and population-focused competencies. So if you notice that there are 3 important things that we need to understand in terms of the process. The first is accredited graduate level. So accreditation, it entails a lot of not only having a program, but being able to address the need and also the needs of the student, but also the faculty. So accredited graduate level education programs. Second is being able to acquire advanced clinical knowledge, which actually talks about preceptorship. So preceptorship or OJT or orally. So being able to have that core competencies or the standards for that to be substantial. And then the third thing that I want to emphasize is a national certification. So we need to have a national certification. So just sharing you what what we have here. So this is actually from my school in the past. So graduate level, it can be for 2 or 3 years. It's up to you if you want masters from a master degree track or if you want a doctorate degree track. But bear in mind that every subject is about 5 units. So I think it's one subject or one course is about 5 units and it's about 1 semester. So before you can even start, you need to make sure that you do the core subject. These include advances in human pathophysiology. So in general, advancement in health assessment across the lifespan. So head to toe, you need to be able to know how to use to use medical equipments to check the ears, to check the eyes, and other things. So, and then the third one is pharmacotherapeutic. So, it's like advanced pharmacology in nursing school. So, human pathophysiology, health assessment, and pharmacology advanced. Those are the core subject. And once you complete that, you can move forward in terms of concentration. So again, remember for certified nurse practitioners, there's different specialty, diba? So specifically for psychiatric nurse practitioners, we do have concentration within the concentration or the focus includes advanced neuropsychopathology, meaning neuroscience, the pathophysiology of the brain. We also have second is the advanced mental health assessment across the lifespan. So not only those MOCA testing, but also other more advanced testing that we can do. We have mental health promotion across the lifespan. We have management of common and complex and chronic mental health disorder. So again, one subject is about 3 to 5 units, and one subject is usually can last for 1 semester. So just imagine. So the add-ons on the other side is something that the only thing that I added here is if you want to do a doctorate degree path or a master's degree path, you also need to understand that it's not for you to just get a degree as a doctorate level, but it's for you to understand why do you need to be a doctorally prepared nurse. So first one is the principles of evidence-based care in advanced practice. That's a very essential one because especially here, the goal is for APRNs to be able to conduct and adopt evidence-based practices. There's a lot of grants and funding for that, and you should all know how to do it and how to implement those. Second is healthcare outcomes management, meaning advancements in healthcare. We have system thinking in a complex healthcare. We have the clinical residency. So the clinical residency is different from the clinical residency in terms of your major. So the clinical residency for the doctorate program, for the doctorate degree, is being out in the public. Again, it's kind of like doing a dissertation, but it's conducting the actual program. We do have the individual in innovation leadership in healthcare practices because that's the plan. If you're a doctorally prepared advanced practice nurse or even a nurse, you need to understand that This is a thing we need to you're going to be you're a nurse leader and you need to understand the concept, principles, and be able to adapt to it. You need to understand healthcare policy and innovation, also dynamics and principles of information in healthcare, biostatistics, of course, and innovation in communication, so scholarly and professional writing. So the clinical residency that I'm pertaining here is the clinical residency for your specialty. So the total hours per population meaning adult, usually it's 50-50, meaning adult, child and adolescent, and then adult. So you need to complete between 500 to 1,500 hours during the second or third year, either with a psychiatrist or a psychiatric nurse practitioner, clinical nurse specialist with 1 year work experience. So as much as of course, as much as we're learning, we also want to understand that we need to do our clinicals with a provider that is knowledgeable too, diba? So I want to emphasize this one because if we want to move forward with this one in the Philippines, this is a crucial one, because it's not only that you're going to be studying in school, it's not only that you're going to get your advanced practice, but who's gonna teach you the hands-on one, or who's gonna be there to do the hands-on one. You will hear other people will say, "Oh, I'm already advanced. I'm already an advanced a psychiatric nurse practitioner in the Philippines." But it's not just you doing the clinicals or you being employed in a psychiatric hospital or psychiatric facility, but also you doing the studying. So those are the two essential ones. So again, clinical residency is also important, and so I want to emphasize this one. Step 2A is to pass a national certification. So same as with us, it's getting the licensure examination. So we call it certification. So the ANCC certification credential is evidence that you met the eligibility requirement and pass appropriate test that assess the knowledge and skill in your certification specialty. And we are required to do 150 hours of continuing education for renewal because, again, the goal, if you remember, in any standards of practice, in any nursing profession, continuing education is very, very important, and research and evidence-based practices. So that's why they emphasize that one. And lastly is step 2B is to obtain licensure. So once you have the certification, now you can apply for licenses. So in the US, NPs are licensed in all US states and the District of Columbia, but under the rules and regulation of the state. So every state has different policies and protocol that we follow. So let's say, for example, I cannot prescribe any stimulants in the state of Nevada because I don't have, they have that special license. So I cannot prescribe any Adderall, Ritalin, Concerta, Vyvanse in the state of Nevada. I can only do that in the state of Arizona, and I cannot practice in any other state. So yun yung sinasabi natin na they have their own rules and regulation that we need to follow, and they're governed with that. Okay. So I think I'm super quick because it only took me probably an hour to discuss it. But this is actually the last two slides that I wanna kind of like you guys to reflect on, to understand more about mental health and psychiatric mental health nurses. If you're familiar with the SPURT charting, so if you're a psychiatric mental health nurse, this is how we do it. We start with the situation, we discuss the background, the assessment, and recommendation. So why did I add this one? So I added this one in this slide because I wanna, as a closing remark, I want to emphasize that as nurses, we need to be assertive. We need to understand and be advocates for our clients. We need to always make sure that we we have the standards and scope of our practice, but we help clients in terms of their own health. So one good example is if you're is this one. So psychiatric mental health nurse charting, the recommendation is to face-to-face needed for continuation of 4 points and permission to repeat last successful PRN of Haldol 10, Ativan 2, Benadryl 100 IM. If you think about it, the way that this nurse is emphasizing or recommending is not very it's very all the information that your psychiatrist needs is already here, diba? So it's not what did they call that one? It's not over empowering the provider, but it's working with the provider because you know your client. So that's what I want to emphasize. For closing remark, I want to show you a chart that hopefully one day, for my fellow nurses in the Philippines, hopefully one day you can be able to report to our psychiatrist when you're on duty. So example is Dr. R. It's Argie Rivera, the on-duty psychiatric clinical nurse specialist, calling about patient RT. You did an evaluation on him yesterday, and today is day 2 admission. Background is patient is currently on Depakote, ER 500, Cymbalta 60 milligrams, Ativan 2 milligrams, and Circle 200 milligrams. History of violence and unprovoked. Assessment, most recent vitals, blood test results were unremarkable, but the Depakote level is 29, which is below the normal range. So being more assertive and knowing where you are. AIMS is negative, so you did your assessment. PHQ-9 has improved from 22 to 18, so you know your other assessment. GAD-7 from 15 to 11. No PRNB 52 given today. Patient is not violent but very irritable. And your recommendation as the specialist is I'm recommending Dr. R to increase the dose of Depakote due to low level, and for repeat Depakote level CMP in 3 days for monitoring. So hopefully one day, you know, we this is something that I'm looking I'm hoping that we can do, because again, it's not only that we are well educated, but also I think the mindset of nurses in the Philippines, or how we were trained to work in a team, also need to be changed in some ways. So that's what I want to emphasize. Again, today, just a recap. We did some objectives, definition of terms. We talked about population being served, clinical settings in psychiatric nursing. We also talked about the part 1, which is psychiatric mental health nurses. Again, you don't need to be master's degree level for that. You just need to have the heart probably to do it or to try it to see if it's for you. And then the part 2 is the psychiatric, the advanced practice registered nurses. We talked about some history in general. For APRNs, we talked about history for specifics for the psychiatric mental health. We also talked about consensus model, differences between CNS versus NPs, and also some examples. So I hope you learned a lot from today's webinar, and I'm open for any question. If I cannot answer, I'll let you know.
Thank you very much, Doc RG, for such informative presentation. But before we proceed, answering some questions, let us all be entertained first by a song number to be given by Miss Christine Asmud, BSN3 student of St. Anthony's College. And while we are being entertained, you may also now start typing your questions in the Q&A section of your control panel for our open forum. Thank you.
Good day, everyone. My name is Christine Jane Asmod, a third-year nursing student from St. Anthony's College. Now be singing Kumpas by Moira de la Torre. Paano bang mapapawi lahat ng mga nasabi? Di naman nakalang ika'y darating lang bigla nang walang babala sa isang iglap. Nagbago lahat, hindi ko na kaya pa na magpanggap. Ikaw ang kumpas ng naliligaw, ikaw ang kulay sa langit na bukaw. Sa bawat bagyo na dumadayo, ikaw ang kanlungan na kailangan ko. Kahit hindi mo alam, ilang beses mo kong iligtas. Ikaw ang hantungan, aking wakas. Anong maniniwala kay nasa aking harapan? Di naman naiplano ako'y mabihag ng ganito. Totoo ba ito? Sa isang iglap nagbago ako, hindi ko na kayang mawalay sa'yo. Ikaw ang kumpas ng naliligaw, ikaw ang kulay sa langit na bukaw. Sa bawat bagyo na dumadayo, ikaw ang kanlungan na kailangan ko. Kahit hindi mo alam, ilang beses mo kong niligtas. Ikaw ang hantungan at aking wakas. Sana iyong matanggap kung sino ako talaga. Ikaw yung kumpas ng naliligaw, naging kulay ka sa langit na bukaw. Sa bawat bagyo na dumayo, ikaw yung kanlungan na nahanap ko. Kahit nung di ko alam, ilang beses mo kong niligtas. Ikaw ang hantungan at aking wakas. Thank you so much.
Thank you so much for that wonderful song, Miss Asmod. Before we entertain your questions, let us first give the virtual floor to Professor Sheila P. Biliran, Faculty of the College of Nursing, West Visayas State University, for her insights and reaction about today's webinar. Ma'am Sheila?
Hello, good morning, everyone. Can I be heard?
Yes, ma'am. Good
So
morning.
good morning to one and all. Dean Aris Bungabong, the president of ADPCN Region 6. Thank you for your invitation to be a reactor in this relevant webinar. So thank you very much, Dr. Argie Rivera, for the very informative and in-depth discussion of the whys and hows of psychiatric nurses. In my almost 3 decades of years of being a nurse, this is one of the few webinars that I have attended that have focused on psychiatric mental health nursing as a nursing subspecialty. So kudos to the organizers for coming up with this much needed webinar. Dr. Rivera has highlighted the roles and scope and standards of practice for both psychiatric nursing and advanced practice nursing. She has given us a glimpse of how it is being a psychiatric nurse specialist and a psychiatric nurse practitioner in the United States. She also left us a question if it is time to have advanced practice registered nurses in the Philippines. In this area of clinical nursing, known as psychiatric mental health nursing, indeed, nurses have a dual role, tending to the needs of patients both in the medical and psychological realms. These nurses care for clients of various ages across the lifespan. They have extensive experience with a wide range of mental health issues such as anxiety, depression, bipolar disorder, post-traumatic stress disorder, schizophrenia, and substance misuse. A psychiatric nurse can promote mental health in various ways. They could work with youngsters exposed to trauma, soldiers and uniformed personnel returning from conflict, adults and adolescents with mental illnesses, and many more. According to Dr. Brock Chisholm, the first Director General of the World Health Organization, there is no physical health without mental health. Indeed, psychological well-being is an integral part of overall health, and mental health nurses work to spread this message to patients, families, and communities. They are committed to eliminating the discrimination that patients with mental health issues face when seeking treatment. The role of the nurse in psychiatric and mental health is multifaceted. They help patients with daily tasks, oversee medication and treatment plans, track patients' progress, confer with psychiatrists and other healthcare providers, and provide emotional and practical support to patients and their loved ones. To create trusted relationships with patients and their families, mental health nursing professions necessitate a high level of empathy, as well as good communication and problem-solving skills. It is critical to maintain open communication and coordination with other staff members in order to carry out intervention plans. I think that one of the greatest challenges of being a PMHN is how to empathize and not sympathize with patients. All nurses, but especially psychiatric and mental health nurses, must walk a fine line between caring for a patient in distress and getting overly emotionally involved. While it is easy to invest too much of herself, the nurse must keep in mind that she is serving the patient's therapeutic needs, and emotional detachment not only protects the patient, but also protects the nurse. Indeed, psychiatric and mental health nurses play an important role in maintaining the psychological well-being of the citizenry. Specifically in the Philippines, with the lack of mental health services and practitioners, plus inadequate mental health facilities, more nurses trained in psychiatric and mental health is needed. Let us try to look at the mental health situation in the country. The Philippines is an archipelago consisting of more than 7,000 islands where over 120 languages are spoken, and we have several religions. The country has been colonized by numerous foreign powers since 1545, and it did not achieve complete independence until 1946. This colonial history has contributed to the unique culture of the Philippines, but the country remains poorly understood. Filipinos have no distinct personality. Filipino cultural ideas vary in every way, and it is a common misconception that sadness and anxiety do not exist and that mental illness is something to be ashamed of. Stigma, or the public's beliefs towards mental illness, has greatly affected how mental health was given attention in the country. Because of this stigma, the Philippine government and public sectors have paid minimal attention to mental health. In 2019, the Philippine Mental Health Act went into effect, and it is anticipated that the public will be increasingly concerned with mental health services and the rights of patients and their families. However, mental health remains poorly resourced, with barely 5% of the total health budget spent on mental health. There are only 7.76 hospital beds and 0.41 psychiatrists for 100,000 people, as reported by the Department of Health in 2018. This ratio is lower than that of other Western Pacific nations with comparable economic conditions, such as Malaysia and Indonesia. As a result, mental illness has become the third most prevalent handicap in the Philippines, with 6 million Filipinos suffering from depression and anxiety. The country has the third highest rate of mental problems in the Western Pacific as a result. In addition, the Philippine WHO Special Initiative for Mental Health, which was conducted in 2020, revealed that 3.6 million Filipinos suffer from at least one form of mental, neurological, or substance use disorder. Males have a higher suicide rate of 4.3 per 100,000 population than females, with 2 per 100,000 population, as reported by a suicide rate of 3.2% per 100% population. However, these figures may be inaccurate because suicides are frequently misclassified as deaths of unknown causes. So the Philippines' mental health care system continues to struggle due to underinvestment, a shortage of trained practitioners, and a lack of robust community resources. The COVID-19 pandemic became a wake-up call for public mental health stakeholders. Imposed quarantines reduced access to social support, and the unmet need for mental health services grows because of a fragmented referral network. Poor mental health conditions are exacerbated by a loss of job security, selective social amelioration programs, and an overwhelmed healthcare system. In a study conducted by Dr. Palaganas and others in 2017, 24% of midwives, 29% of physicians, 51% of nurses, and 61% of physical therapists expressed a desire to work as health professionals in the United States, Canada, Australia, and the United Kingdom. Their movements caused shortages of health personnel, decreases in the provision of health services, low quality of healthcare services, higher wait times for patients, and increased overtime work. And their decisions to migrate were mostly inspired by the greater number of career prospects and higher wages abroad, where they are accorded greater respect and quality of practice, which significantly improves their well-being. Since many qualified professionals continue to depart, increased investment in training and recruitment of psychiatrists, nurses, psychologists, social workers, and other members of multidisciplinary teams is critically needed. The nursing leaders and educators in the country has seen the importance of ensuring that BSN graduates are ready to render mental health care services to the clientele. CMO 15 series of 2017 policy standards and guidelines for the Bachelor of Science in Nursing program has added 102 RLE hours or an additional of 2 units of RLE for the care of clients with maladaptive behaviors. BSN graduates have the competencies to care for clients with mental illnesses. However, more training is required to prepare Filipino nurses to provide better mental health care. There is a dearth of seminars and webinars about psychiatric and mental health nursing. Dr. Rivera and the organizers of these webinars are to be commended for focusing on psychiatric mental health nursing or nurses for a change. With the promulgation of the Mental Health Act of 2019, mental health issues were given attention in professional nursing seminars and conferences, but they were typically centered on enhancing the nurses' resiliency, how to manage stress, and encouraging self-care and mental health promotion. The importance of psychiatric nursing as a nursing specialty, which is equally as important as other nursing subspecialties, has not been emphasized. So I look forward to the establishment of advanced training for mental nurses in the country in the near future. If the Philippines would also have advanced practice registered nurses who are educated and certified to assess, diagnose, and treat patient issues, as well as order tests and prescribe medications, they can be a critical supplement to mental health practitioners in the country. So similar to the United States, APRNs can also play an important role in the Philippine healthcare system. So may more Filipino nurses join the group of psychiatric and mental health nurses. And with the leadership of Dr. Argie Rivera and the other advocates of psychiatry and mental health nursing, may this nursing subspecialty in the country grow and prosper. So thank you everyone and good morning.
Thank you so much, Professor Biliran, for sharing your insights. And we would like to award a certificate of appreciation to you as our reactor for today's webinar. The citation reads, Certificate of Appreciation is given to Professor Sheila P. Biliran for sharing her invaluable time and expertise as reactor in the webinar entitled The Whys and Hows of Psychiatric Nurses and APRNs. Given this 28th day of January 2023 via Zoom, signed by Professor Violeta A. Lopez, RN, PhD, FACN, FiND Network President, signed Dr. Rosana Grace Bello de la Riarte, and signed Dean Aris Kendall R. Bungapo. Thank you, ma'am.
Thank you very much. It was a pleasure.
At this juncture, we will now move on to the open forum. I believe that Doc Argie is not just ready, but also excited to answer your questions. Let us check our question box for Q&A.
I actually started answering. So for those of you who asked and then was able to receive my responses, so I tried that. And for others, I just clicked that I want to answer it live so we can share it to everyone.
Okay.
Do we have questions in other social media?
Let us check in our Facebook Live. Do you have questions?
So I can.
Okay, so just for everybody's information, maybe we can hear from Dr. Argie her response for a question from Peter Tom Kalang. As a DNP holder, what is or are the most significant contributions you have contributed to the advancement of psychiatric nursing practice?
So, so in terms of advancement in psychiatric nursing practice, so during the COVID pandemic, that is the time that me and my late friend Russell Gahede, we kind of like brainstorm and then founded also or established the Kalingang Psychiatric Nurses Initiative with the goal to assist, to create and to partner with nurse-led mental health programs, and even Dean Aris is one of our board members. So that is one contribution, because the goal in mind is to advance, for everyone to advance. Let's put it that way, not only for us, but for everyone. So that's the first one. The second one is with the DNP as a degree, I was able to join the Northern Arizona. So it's kind of like Northern Visayas or Southern, I'm not sure, or Visayas, Visayas area in terms of quality improvement measures, making sure how to, what are the best practices for eight community mental health clinics here in Arizona, in Northern Arizona, checking the best practices for clients to not to prevent readmission to psychiatric hospital. So that's the second one. And then the third one is in terms of what was the most recent one? In terms of my current workplace, because I work 100% remotely, I'm one of the providers for children and adolescents. So I'm starting to do some resource materials that I can give to parents. So whenever I prescribe medication, they have something to bring with them at home, so they know what the medication is for. So again, any little things can be worthwhile if you put out your heart to it. So those are the advancement, and I'm not here to and they're aware I'm not used with a lot of crowds, so I'm not here to tell what I've done or what I've not done, but I'm here to for you guys to understand that you can do so much if you want it. Okay,
Thank you, Doc. We have here another question.
So the second, yeah, go ahead.
Yes. Here, from the same participant. So is it possible for nursing students to be deployed instead, or the special education centers for their psychiatric nursing related experience? And follow-up question, which of the SPED learners should they focus on to be related to psychiatric nursing?
Okay, so what I can say, because I see kiddos that need to have extra tutoring or extra services they need because of their behavioral issues. So I do feel that nurses, student nurses in general, can shadow or can have their OJT or RLE. They don't really need to be hands-on, but at least they have some insights about it or what's happening in a special education program or class, because they will learn tremendously. They will learn how even students behave, how they interact, how teachers are able to intervene. So those kind of scenarios, which are also included as in the world of mental health. Diba? Psychology, psychiatry works hand in hand. So I do feel that that is essential, Peter, and something that you can lobby in your school, because we always need to get out of our box, and we always need to make sure that the people around us, especially our future nurse leaders, are aware of what they can, where they can work in the future, or what other things they're missing, you know. So yeah, so that's my answer for that.
Thank you, Doc. Another question. MAN and PhD in nursing from the Philippine Studies would be acceptable prerequisite for taking up NP?
Okay, so I think there's another question asking if the MSN, So I can answer simultaneously. So another question here is if a master's in psychiatric nursing degree here in the Philippines will be recognized in the US. And then this question, unfortunately, and this is based from experience. So I have my master's degree in the University of Santo Tomas, specializing in advanced psychiatric nursing. And it was not credited just because, and I agree with that, because of the curriculum, because of the subjects and the courses. Remember, I was discussing what subjects you need to study if you want to be a nurse practitioner, psychiatric nurse practitioner, clinical nurse specialist. It's way different. So I think that is my answer. It's one of the things that we need to sit down to look to kind of like make sure that we know that the program we're offering is going to be accredited and can answer the certification.
Thank you, Doc. This one from one of our anonymous attendees. This is a nice question. How do you handle a patient when there are concerns about your own safety?
So the reason that I want to answer this live is, first, to be honest, I pray. No, I'm going to be honest with that. Second is, the good thing about working in a company is that even before you start working in any clinical setting in the world of psychiatry, they have their own policies and protocols. So one example is when I worked in a community mental health clinic, health center. It's similar with our health center in the Philippines. We have this push button in the table. So if there's a client that is very escalated, or you feel that you're not safe, you can push that one and it will alarm. Another one is you can send a quick email, like code green. Everybody is aware. Next thing you know, somebody's knocking at your door. The third one is emails, push buttons. Third one is because before the client will go in and see you as the nurse, that client will see the receptionist, diba? The front desk or behavioral health worker sa atin. And they're aware, they're very good observant. They know if a client is really agitated, and they will step up too. So having a good team actually helps with that. Praying helps with that. And having a good policy and protocol helps with that too.
Okay. Another question. Maybe we'd like to know what's your reaction in this now. It seems that if you are a regular nurse in the Philippines, we have so many things to accomplish first to be considered in the APRN level.
I think I can say yes. I can attest to that. There are things that need to be focused on. There are things that we need to still polish. We're way behind, but it doesn't mean that we're bad nurses, or that doesn't mean that we're insufficient, that we're not successful in our little ways. The reason that we talk about advanced practice nurses is because we talk about it. It gives us that sense of, I think it ticks your brain to think about how is it to advance in that level, and what should be done in the entry level to advance to that level. You see what I mean with that? Because the good thing about changes in general is changes is going to be like that. Until we die, there's going to be changes. But if we don't accept that change and we don't harness its own potential, like positivity-wise, and how to move forward, you're just going to be stuck in there. I think that is what is happening. So if you've heard a lot of those questioning, a lot of those hiccups with that, then that's okay. That's why we're talking about it. Same thing when there's chismis, di ba? Pag-uusapan, but it doesn't mean that you're gonna stop it, or you're not gonna do it. So it's just something that we need to talk about to advance in our own profession.
Okay, thank you, Doc. Another question from one of our participants, and I believe many participants wants to know the answer about this question. Hello, Doc. Can you tell us more about your experience in taking a doctorate degree in the US, like duration, tuition fee, etc.?
So I get experience in terms of, is it nerve-wracking? Is it very hard? Is it difficult? For me, my my personality wise, or my own principle in life is nothing is easy. If you don't want to do something, it's even in, for example, if you're trying a hobby, it's not easy, diba? You want to try it. So in terms of taking up advanced degree, it's very difficult, it's very nerve-wracking, it's overwhelming, but if you like it, if your heart is into it, you're going to complete it. You're going to be successful with that. In terms of the tuition, it varies. I cannot talk about that. What I can say is because the country, the US as a country, is very pro advanced practice registered nurses, physician assistant. They have their own grants that they can give for tuition reimbursement. They have their own, just to push people to study and to provide for the needs. So they have a lot of programs. So again, this is not me to compare, but this is me just to kind of like tick your mind in that aspect. Probably it's similar with other countries then. But so those are my answers.
Okay. So another question. Do we still ask the whys to our psychiatric patients? And how would you ask a why question to a psychiatric patient to know the reason behind a response? Then a follow-up question from Lacey. Can you share the most challenging experience you had with a psychiatric patient?
So in terms of the whys, hold on, let's see here. So whys, so yes, we don't ask whys. I ask for what reason. How do you feel about it? For what reason? How do you feel about it? Tell me more about it. How does it make you feel? So no whys. Because if I ask you with a why, you're gonna feel not good about it, diba? It feels like you're being judgmental. It's just, yes, it's just one word, but it entails a lot of meaning. So we don't use that one. I use the other things, the other words. In Tagalog, we can use, sa anong kadahilanan? You know, so parang malalim, diba? But just imagine, put yourself in their shoes, or if your kapitbahay will ask you, bakit ang taba mo? Di ba ang sakit? Ang sakit. Pero pag tinanong ka na, sa anong kadahilanan ka nagiging malusog? Parang iba yung context, right? So it's just a matter of knowing what to use, what specific words to use, and how to use it appropriately. Then the second question is, can you share the most challenging experience? So the most challenging experience is during my first day as a psychiatric nurse practitioner. So first day, for some reason, I was given a very complex client. Complex in a sense that it rattled my own principle, because that client, I'm not racist, let's put it that way, but we know how it goes. If di ba, if you see some American movies, yung mga in jail na Black Americans, or yung mga riots and whatnot, and just imagine my first day. What happened during that day was he stood in front of me. He was like big one, like 6-footer probably, and I'm only 5'2". First day. So challenging in a sense that it rattled my core, it rattled my principle, but that specific incident helped me to understand the reality, reality that I need to make sure that I set aside my own mindset, my own principle, and I need to make sure that I work as a provider. So that is the most challenging one for me, to be honest. Until this date, nobody has I haven't felt as belittled, maybe because I was new, and that was the one. And I think that guy was struggling with bipolar disorder. So I've seen a lot of psychotic clients, I've seen a lot of substance use clients, but probably because I was still building my own core, that's why it was very complex for me. And I always share that to my students, so you will better understand yourself. Because after an incident, what happened during that time is I cried with the provider next door. We talked about it, and then we processed it, and then I did my own reflection, and then The rest is history. And you will feel that way. It's just human nature.
Okay, so let me just ask a question from Sir Jerome Babate. What is the psychiatric nurse practitioner's philosophy on medication and treatment? This is posted in our chat box.
And then meron siyang follow-up. Do you typically recommend medication? What coping method? Okay. So first question is a principle and philosophy in terms of medication management. So psychiatric nurse practitioners still practice within that holistic care as a whole. If you're going to ask me medication management, or if I like it, or if I want to do that, my rule of thumb is if I see a client who has been struggling with depression and anxiety and is affecting quality of life. One good example is a recent client that I've seen. 2 years na siyang depressed, 2 years na siyang worried, anxious, you know. When I saw her for the first time, because she was not being seen by anyone, she just learned how to cope, but functionality-wise, it's not there. She cannot be the mom. She cannot be the wife. As you know, she cannot use the best of her abilities to be that. And that is usually my rule of thumb. If functionality is affected, if you cannot have a quality life, if you cannot even build a relationship or social interaction, we need to discuss medication management. It's a different story in terms of population, because my focus is usually, I like child and adolescent because I feel young probably. I just look young, but at least I feel young if I see child and adolescent, and then adults. But my rule of thumb is it's different in terms of population, diba? Child and adolescent, if they haven't done therapy, they're not suicidal, they're not homicidal. I don't usually medicate them. I usually want them to exert effort with therapy for about 3 to 6 months, and then we revisit me, check with me every 3 months to 6 months. And then if still he or she struggle, I usually recommend that, or if there's a family history. I don't wait for these clients to decline, because we want them to be successful. That's the plan. So child and adolescent, different from young adults, different from elderly. So it's case-to-case basis. But again, I always tell my clients and their family, because I always put myself in their shoes, sino bang gustong uminom ng gamot? Ikaw nga kung may blood pressure, di ba? Or if my mom has diabetic, she doesn't even want to take her medication for about 2 years. It took her 2 years to take one. So paano pa yung mga client natin na not as educated, di ba? So we always want to put ourselves in their shoes, but we always want them to understand that functionality is very important for them to have a quality of life. So yun yung pinaka-essential niya. So I hope I answered that question, but that is just how I explain it.
Okay, thank you, Doc. We have here another question. What are the most common mental illnesses you've been encountered during the pandemic? And when is the time or the reasons that the NPs refer patients to physicians?
Okay. So the first answer is, during the pandemic, unfortunately, child and adolescent population, again, there's an abundance of them being depressed, being suicidal, being more anxious than usual, because yung social interaction, we will always go back to that developmental milestone, di ba? Yun yung nawala sa kanila. So, hindi naman ibig sabihin na puro lang sila social media. May nawala sa kanila in terms of their own developments that they need to meet, that they haven't met for about 2 years. So, yung child and adolescent population, yung mostly na-affected, to be honest, in my area. And then mostly anxiety and depression, not a lot in terms of the SMI population. Mas naging, kumbaga, for example, si Juan Luna, it has been okay for years and years, and then during the pandemic, na worsen yung kanyang major depressive disorder because of situation. So those are what I've noticed. And to answer that question, so remember the reason, again, that I emphasize standard of practice, nursing practice, and competencies is because as nurse practitioners, number one rule is you need to know your limits. You cannot be just a know-it-all. And that is something that I always emphasize in in my colleagues in the Philippines. If you want to move forward, we cannot be know-it-all. It's not. It doesn't work that way. We need to work as a team, you know. And the good thing about it is, I even tell clients, you know, if I don't know your case, we need to sit down with our head psychiatrist to gather more insight. I'm just being honest. This is my limitation. So I tell them I don't feel bad about it, diba? I know my limitation. From day first, that's what I've been doing. My weaknesses, meaning clients that I'm not gonna see because I don't have experience, forensic, puntis, OBGYN, nope. Maybe postpartum, yep, but OBGYN, like my babies. Substance use population is also my weakness, including opiate use disorder and then stimulant. Those are my three weaknesses. And it's not that it's not my cup of tea. I just know my limitation and where my knowledge and my training is. So again, you cannot be know-it-all, and you need to always make sure that you work with your team about it. Wraparound services.
Thank you, Doc. From Carlo Vivar. Thank you, Dr. Argie, for the discussion. I have a question regarding advanced practice in the Philippines. What are the things needed to be done or reformed in the country in order to recognize APRN?
Going back to the discussion, it's going to be focused on that LACE, yung consensus model. That's why even though it's US based, I feel that it's very essential. At least meron kang baseline to follow, diba? Evidence-based practice, or it's still about benchmarking. Licensure, you need to work on that. Accreditation, certification, graduate school, residency, preceptorship. So it entails a lot of commitment and understanding in that aspect. And so to be honest, when we founded the Psychiatric Mental Health Nurses in the Philippines, which is it's now dormant, we were talking about it. So it's been 2009. It's 2023. So, but it doesn't mean that it's not going to happen. Maybe in the future, maybe not in this lifetime, but at least we're still talking about it. We're still in the discussion, diba? There's a lot of things that need to be done, but personally, I feel that the one thing that is also going to be crucial is and probably this is just me, but finding a preceptor or a faculty that will be able to teach it. Not because we don't have competent faculty in the Philippines, kasi ibang genre na siya, diba? Hindi naman siya ibang genre, ibang focus. Again, I want to emphasize, if you're working in for example, in a psychiatric hospital for decades and decades, and you still need to do that schooling because it entails a lot more than what you learn from experience. It entails a lot of advancement in terms of pharmacology, psychopharmacology, mental health assessment, neuroscience, complex, moderately complex, not complex at all mental disorders. So it entails just having that workplace. It's both education and then work. So just want to emphasize that.
Doc, from one of our participants, it is very saddening that in our country there are no programs for mental health. Thankfully, there are few people who initiates program for people suffering mental health conditions. What do you think, ma'am, is the best way to reach out to the government to give more attention to mental health? And we have here from Mary Jane Amores. I think this is also related to the question. Any plan of the government or any private sector for the increasing number of mental illness here in the Philippines?
So I cannot speak in terms of the government's behalf. And you know what I mean. What I can only say is what we can do as individuals, as nurses. That was the main objectives of our organization, the KPNI, making sure that we work hand in hand with other nonprofits in the Philippines and find ways on how we can advance in any way possible. And I know probably he's watching, but we just did a training I just did a training 2 weeks ago in Mindanao to have a community mental health clinic founded by a nonprofit, and making sure that they know what evidence-based practice they can incorporate. That is what we did. So that's a good thing. That's a nonprofit from a nonprofit to a nonprofit. Let's put it this way, I don't rely on the government because I know there is still so much we can do as individuals and as providers, as individuals, as nurses, and as humans, you know. Gone are the days that we will just wait for them. This is about the time that we need to move forward and do other things. Other projects that we have are those mental health lounges with other universities. We have trainings like the nurse counselor training. So we do a lot of things the best way possible in any areas in the Philippines, and to advance, for everyone to advance. So let's put it that way. So I cannot again attest, I cannot speak on the government and private sector's behalf. I can only speak on nonprofit and what we do, what we're doing, and what we will be doing moving forward. At least hindi tayo-tide. I mean, at least we can do what we feel needs to be done, diba? Or at least we know we can do what our heart wants us to do, rather than waiting, and next thing you know, severe case na, you know. So I hope I answered that question.
Okay, thank you, Doc. Why is the youth today less capable of handling problems and struggles? This question is from Marife Patinas.
So the reason that I want to answer this live is, if put yourself in their shoes. So that is how that is one way for me to understand my patient, diba? Put yourself in their shoes, diba? When during like 50 years ago, diba, the way that our parents or their parents raised our parents is different than how our parents raised us, or we are raising our kids, diba? So there's a lot of changes that is happening. And one thing I can say is, because there's a lot of advancement changes in terms of now everything is social media. Now it's mostly being at home doing things, not being more outdoors, you know. So it doesn't mean that the next generation has issues. It's just that everything is advancing, and we just need to learn how to cope and how to address that. So one good example is if you have a kiddo, diba? Before, wala naman tayong cellphone. They cannot watch in the TV kasi black and white or walang iPad. Nokia pa yung phone noon. Then what we need to do is we need to play outside, 10-20 or those pico. Now there's that iPod and cell phone, social media. It's a matter of knowing how to intervene. So let's say if you're the mom, you're the parent, you're the guardian, of course you want to limit that one. You want to emphasize other areas for them to enjoy, like being outdoors, because that helps a lot, diba? So they know how to handle their own struggles and their own problems. And so it's changing, and you should know how to adapt to that changes too. And everyone needs to have the tools to know how to adapt in those changes too, like what we're doing. Before, we cannot do this one, diba? But now we can reach a lot of nurses in the Philippines, and so everything is just moving forward.
Thank you, Doc. We have a question here from Marjorie Anmuto. Is psychiatric nursing your first choice? And see here another question from her. Mom, what can you advise to nurses who are having second thoughts of pursuing a masteral in this field?
So psychiatric nursing is not my first choice. It's actually that is my lowest score in my nursing, like, ano ba tawag sa atin? Philippine Nursing Licensure Exam. But because that was my lowest score, it ticked my mind in terms of bakit ako mababa? But yun ang mababa ko? Bakit favorite kang med-surg? What is it in there that I need to understand? I think that is where it all started. Because human nature for us, we want to have answers, diba? And then by having answers, we better understand ourselves. So it's not my first choice. That's my lowest. Second is, if you think about it, who wants to work in a psychiatric hospital, diba? Mindset, or yung kung how the society dictates psychiatric nursing during my time. Third is, hindi naman ganun kadami ang psychiatric hospital in the Philippines. So my first job is public health nurse. So very different experience. But if you think about it, everything boils down to mental health then. If I worked at the OBGYN, how many clients or how many moms struggled with postpartum psychosis, postpartum depression, med-surg, how many clients had their surgery and now, or stroke even, or surgery that now has depression. Diba? So a lot of those areas intertwined. And then the other one is, what can you advise to nurses who are having second thought? I guess what my question with that is, they need to first know what they want to do. So kasi mahirap yung I mean, first and foremost, the first question is, what do you want to do? Have you found your calling? Have you found where you want to be? Kasi you're gonna exert effort, time, and money, and it's not cheap. Even especially in the Philippines, we have a scholarship, but we don't have grants. But so what's your desire? What's your calling? What's your that's my question. Even to my sister, that is my question. Ba't gusto mo mag-doktor? What's the reason? Because it will always go back to that mindset. Whenever you struggle, whenever you get overwhelmed, it will always go back to that, yung calling mo, or yung kung ano yung gusto mo, bakit mo siya kinuha. And for me, honestly, my calling for this one, and something personal, is I prayed for that. I prayed that if God wants me to go to the US, I was in the peak of my career in the Philippines. We were doing okay. I have work, I have school, everything is doing well. I have the organization, but I prayed that if this is something that you want me to advance, I'm gonna go for it. And this is where I am right now, and I'm happy. So I think that is the assessment, personal assessment of your own growth, of personal growth. That is very important, because it's super easy to do masters. I mean, diba? There are schools that you can just go and do it very easily. But is it worthy? Is it worthwhile? Will it advance you as a person? That is a big question.
Okay, thank you, Doc. And thank you so much for your questions. We wish to accommodate more, but we will just be entertaining one more question because our time is limited. And this is a question from Rosalie Lopez. Now, as an RN, how can we effectively encourage people struggling with mental health condition to seek professional help, since there is a stigma revolving mental health?
So health education, if you're one of those that really want to educate the public about mental health, go to your barangays, go to your health center, ask what they have, what programs they have. If they don't have, offer programs, talk about it, talk in your social media, like what we're doing, in making sure that we tick their brain and we kind of pinch their heart that, hey, you need to seek treatment. You need to maybe talk to somebody, or even offer yourself, even send a private message. Hey, kamusta ka? You want to talk? Even as simple as that will be very beneficial, because at the end of the day, we want to make sure that we offer ourselves to them and that we're ready. And everything will follow. To be honest, the good thing about what has happened with the pandemic is it opened a lot of doors in terms of mental health, focusing on mental health. Diba? Ang daming mga actors and actors who are open in terms of what they struggle, and then even the mental health law, even a lot of, even this kind of webinars. So dumadami siya ng dumadami. Still a lot of things that needs to be done, but at least, we get things started. So thanks for that question.
Okay, Doc Argie, thank you very much for answering and helping us understand more the why and hows of psychiatric nurses. and APRNs. And now we would like to award the Certificate of Appreciation to our speaker. The citation reads, Certificate of Appreciation is given to Dr. Argie J. Rivera for sharing her invaluable time and expertise as resource speaker in the webinar entitled The Wise and House of Psychiatric Nurses and APRNs, given this 28th day of January 2023 via Zoom. Signed, Professor Violeta A. Lopez, signed, Dr. Rosana Grace Bello, and signed, Sir Aris Kendall R. Bongabo. Thank you, Doc.
You're welcome. I'm just trying to answer some of the other questions. So. Okay.
Okay, so for the closing remarks, let us give the virtual floor to Sir Aris Kendall R. Bongabo. Sir.
Okay, so good morning, everyone. It's already afternoon here in the Philippines. So unfortunately, Professor Cindy Lay is not able to join us. So in behalf of the organizers of this webinar, I would like to thank Dr. Argie Rivera for accepting our invitation and for this wonderful and very interesting topic. Also, I would like to thank the Filipino Nursing Diaspora Network, headed by Professor Violeta Lopez and Sir Jerome Babate, for allowing St. Anthony's College to host this webinar series. So this is already our second webinar series, and we will have the third one by March, another excellent international Filipino nurse, our speaker. I would also like to thank Dr. Rosana Grace Bello of PNA Region 6 and Ma'am Helen Caton of ANSAP Iloilo for collaborating and partnering with us. So for the e-certificate, kindly fill up the evaluation, and immediately or within a few minutes, you will be receiving in your email the computer-generated certificate with the CPD units. Also, I would like to remind all participants to kindly fill up the evaluation form correctly, because we will be submitting the names to the online platform of PRC for the CPD. So we have encountered several errors for those attendees who were not able to input their names correctly and even their license number. So if there are some problems receiving certificate, kindly email us in the official email of St. Anthony's College, since we have thousands. We have 7,000 registered participants, so this is quite a bulk number. And we are hoping that you will still be attending our future webinars. Again, thank you everyone for attending.
Thank you, sir. And again, thank you everyone for actively participating in today's webinar. We greatly appreciate all of you, our 1,000 participants here in Zoom and more in Facebook Live. So thank you very much for sharing your time with us. So in behalf of the St. Anthony's College and the Filipino Nursing Diaspora Network, ADPCN 6, PNA Region 6, and ANSAP Iloilo Chapter, thank you for joining us today and have a great rest